Thank you, Michael, and thank you everyone for joining us today. I'm Sanjeev Sah, Vice President and Chief Information Security Officer at Centura Health. Here with me to discuss third-party risk management are Dan Bowden, Vice President and Chief Information Security Officer for Sentara Healthcare, and Pritesh Parekh, Chief Trust and Security Officer at Virtustream, a provider of cloud computing services. Dan, please allow me to begin with you. How many third parties do you work with today compared to 5 years ago? Do you expect the number of third-party relationships to escalate? What's driving that?
That's a great question, Sanjeev. I think we are now in the area of probably 500 or 600 now that we track and keep a record of on the cybersecurity program. Our health system has active contracts with probably 3 to 4 times that right now. And we are trying to figure out what the right number is, because as you can imagine, it's difficult to update records and keep things current all the time. So we're very blessed that there is an enterprise level contract management lifecycle project underway to help us get a handle on what contracts are in place, which ones should be in place. And I believe that will better inform and provide better artifact input for the type of risk we try to manage in the cybersecurity program.
So Dan, so is your strategy to go from more to less or less to more third parties, and why? And Pritesh, if you could also provide your response to that.
I think that the strategy is both. More of those that have a high risk level associated with them. And that's the challenge right now, is we want to get a complete picture and then start doing some ranking. And we call it sort of that high and why ranking. Which are high risk? Why are they high risk? Is it due to confidentiality, integrity, or service availability concerns? And then how do we engage with the business units who are owners of those relationships, and how do we ask the right questions to see that risk is being appropriately managed, either for any of those areas, confidentiality, integrity, or availability. So I think there will be some more we add for high risk, but we want to try to get the number to the right number. So I would say both. It will go up and down.
Excellent. Pritesh?
Yeah, so as Dan mentioned, it really depends on the business need, right? The number of third parties can go up or down. The key is really forming a trusted partnership with the third party service providers. As you can imagine, Dan was mentioning about the risk management. It's all around how do you kind of manage the risk. Higher the number of third parties is going to increase the management overhead. You need to perform the risk assessment. You really need to kind of make it part of your security program. And with the trusted third parties, if you have the strong trusted partnership with the third parties, not only the organization can decrease the overhead, the management overhead, but also reduce the business exposure. And the third-party cloud provider, especially with the cloud providers, the cloud environment is constantly changing. The cyber attacks are getting more and more sophisticated, and the annual assessments, the management overhead is no longer going to be sufficient. So I think the key is all around building this trusted partnership with the third-party providers.
Pritesh, just like my organization, we've seen dramatic increases in remote care, remote workforce. COVID-19 has really pushed more healthcare organizations to consider cloud computing than ever before. What are the top concerns you hear from clients or prospective clients when deciding to run mission-critical systems such as EHR in the cloud?
Yeah, great question. It's a huge learning curve. First of all, it's a very significant learning curve for the healthcare organizations that have traditionally managed everything internally. The tools and techniques used to manage these on-prem workloads cannot just be simply extended into the cloud. The organizations are leveraging these cloud-native tools that work really well with the cloud ecosystem to fully realize the benefits of the cloud. Now, what's really happening with the healthcare organization is that they're in this transitioning phase. They're running hybrid multi-cloud workloads where they're, in some cases, moving some of the workloads to the cloud, at the same time managing the workloads on-prem. And with that, there's plethora of tools and technologies that they need to manage to maintain their security posture. And that is increasing the complexity. And there's a need for skill set to manage all these tools and technologies. And since the tools, process, and skill sets are so different in on-prem and the cloud environment, what's happening with these organizations is that they have to manage different security programs, different programs for their data center, the on-prem workload versus the one in the cloud. And that is extremely challenging to deliver consistent security across all the workloads. So what we are hearing from these organizations is really finding opportunities to unify and simplify their approach on security processes and delivering consistent set of security controls across all the cloud platforms.
Pritesh, to your point, in our organizations, we actually felt COVID-19 gave us an opportunity to really drive digital transformation in a way that gave us an opportunity to adapt new technologies. So Dan, given that's been the circumstance and situation during COVID-19, what's your perspective on this topic?
Well, really, relative to digital transformation, it was a very interesting experience for Sentara. We actually had went very far down the path the past year or two in developing new patient platforms, a new mobile app, new portal, and as the same for our health plan members. The challenge that we have is anyone who develops a new mobile app or web portal is adoption. And so coming into 2020, we actually had corporate level goals to address, can we get more app downloads, more people using the app, and can we actually increase the number of telehealth visits? Because we had as many health systems integrated telehealth functionality with our EHR, integrated it with our mobile apps. And so I was very blessed to be working with a technology group and leadership who really pushed us to be ready for this when 2020 started. And so we had an interesting experience with telehealth. February, we probably had 200 or 300 total telehealth visits. Between mid-March and mid-April, we had 60,000. And so we kind of were in that if we build it, they will come. And the sad part is that it took a pandemic, but it did help us see that we had built something useful. And it also helped us see how we can improve things. And well, what's the next step for our mobile app? And what's the next level of functionality we want to deliver to keep people using it and engaged? So it was a great learning experience for us. And really, I feel like broadly speaking, we were prepared for the digital end in terms of engagement with our patients and health plan members. And we put enough of the good security controls in place to accommodate work from home, which was a different angle. It kind of telehealth and telework. And on the telework side, fortunately, we had already adopted completely enforced two-factor authentication, privilege access management, things like that made definitely smoothed out the transition and helped us work hard to train our workforce to adapt to that new environment.
Yes, Dan, couldn't agree more with you. In this new norm, third-party relationships have helped us enable capabilities to really transform. What would you advise our audience to consider when performing cyber due diligence or considering doing business with a new vendor? Is there a formal process for vetting vendors and vendor risk? And how have you either simplified it or improved that process over time?
Wow, what a great question. It's very challenging. Going back 4 years ago, we knew we weren't asking enough. And so we set about developing questionnaires and got to where we were asking a dozen or 20 or 50 questions, depending on the risk, and learning a lot of information. And then about 2.5 years ago, among all of us, third parties, health systems, payers, we all started complaining about the questionnaires. Me complaining you wouldn't fill it out, and the vendor complaining I sent it to them. And so we then we started, well, do we just ask a question about a framework? Is high trust good enough? Is SOC 2 good enough? And what we learned was a 50 or 100 question questionnaire wasn't good enough. Neither was SOC 2 or high trust to assure that maybe some of the very basic critical controls are in place. And so we've kind of run all the way around that tree and coming back to saying, well, what are the most critical controls? So we've been doing more analysis to understand of the big security incidents that have happened the past year or so, what was the missing control that would have prevented that? And so we're coming back to those basic critical controls, and something simple as, do you have fully enforced two-factor authentication, all of your workforce, all of your remote access points, and start there. And if not, I'll go right back to business and say, hey, I'm betting this organization has a major security event within 12 months, and just show the record of what we've seen out there. So we've run the full path of, do I just ask about 2FA? Do I send 100 question questionnaire? So we're trying to find what the right balance is. And I think there are some areas that the way insurance works out, we'll need to see a certification, SOC 2 Type 2, I trust. But in terms of real deal, are you going to have a breach? Then we need to ask about critical controls like 2FA, privileged access management, things like that.
So Dan, to me, sounds like focusing on criticality and effectiveness of those controls are also important as we look at certifications and so on. Pritesh, so in relationships with third parties, there's a shared responsibility component in that. And so what does the cloud service provider own versus what is the healthcare provider responsible for when it comes to responsibility for the security controls effectiveness, as Dan was highlighting in his response?
Yeah, great question, Sanjeev. So just to add to what Dan mentioned earlier, right? So assessment is definitely a big piece of making sure that you're doing your due diligence with the third-party vendors. The challenge is really around the constantly changing environment. Some of these third parties are changing their services, doing releases on a daily basis, multiple times a day. The code is constantly changing. So I think that the key here is like the expectation from the service partner should be to give a near real time visibility across the security and compliance for all their workloads. That should be the expectation from the healthcare organizations for their service partners. This is really to help detect a cyber attack before it becomes a data breach. So I just wanted to kind of finish on that one before we kind of move to the shared responsibility. And now, in terms of shared responsibility, most of the cloud providers have some sort of shared responsibility model. It really depends on the type of cloud service model. So if it's a IaaS, PaaS, or SaaS, right? For IaaS, for example, most of the cloud provider will claim that security of the cloud is service provider's responsibility, and security in the cloud is customer's responsibility. The higher up you go in the stack, typically the service provider takes on more responsibility. So for a SaaS, right, there's less responsibility on the customer, versus service provider pretty much owns the entire stack. So one of the challenge that we've seen with a lot of our customers, and especially healthcare organization, is just incorrectly assuming the shared responsibility model. Right? A simple example of this is really around patching the virtual machines or managing logs. And because of these misunderstanding in terms of shared responsibility, what's happening, it's creating gaps in security coverage, because neither the service provider is actually addressing the gaps, neither the organizations are covering as part of the security program. So, one key message is really important for organizations to understand the shared responsibility model and make sure they're embedding that into the security program.
Dan, so what's your perspective on this responsibility matrix as it relates to third-party relationships?
I really appreciate Pritesh's comments on this, and it is crucial to do your homework and know what you're accountable for. And as Pritesh mentioned, if it's software as a service, it may be pretty basic. It may be directory services integration, single sign-on, two-factor authentication. And depending on your risk posture, maybe you're done there. But if you're actually running and using public cloud, your subscription in Azure or AWS as though it's creatable, destroyable, consumable resources in your data center, only in the cloud, your team needs to be very good at understanding the principles of cloud technology for so many reasons. Security and configuration management is crucial, but also cost management as well. And that's something that a lot of organizations forget about when they just try to start spinning up resources there.
Well, I reckon your organization is anything like mine. Technology is not just an IT issue anymore. Every department has a technology component, from HR to finance, that it includes exchange of information and data. So as we talk about shared responsibility with third parties, how do you make third-party risk management an organizational responsibility, and how do you communicate risk to internal and executive leadership within the organization? So Dan, go with you first.
I think it starts with governance. And if the organization understands, all right, to your point, Sanjeev, that now there's this technology component that enables a business function to happen, a clinical function, an administrative function, a financial function. And what is that technology component? And what are the possible risks involved with it? And we talk about, is there a risk of data loss? How would that happen? And this is where we do sort of that old-fashioned CISO stuff, right? Where we talk about assets, threats, vulnerabilities, likelihood, and impact. And is there a potential threat of data being lost? What if the data is corrupted? What if the service just goes down? And what's the impact to patient safety? What's the impact to our finances, et cetera? And so I think that if you start at that governance level, it's much easier to get the business engaged. And then when you complete or get through your assessment, they provide better input about what their risk tolerance is, how far they want to go in order to increase protections for data or increase resilience of the service.
Dan, if I can just follow up on that, in my experience was in my organization that during COVID, we were being asked to enable, review, and approve a number of technology solutions, which sometimes needed to be fast-tracked within our processes. So how do you decide what battles to fight and when to make a recommendation to just go about your business? How do you do that in circumstances like during COVID?
Well, it's interesting, right? In COVID, sometimes we joke about garage band startup IT companies or software companies. And wow, March through June, they just came flying out of the woodwork with every kind of solution, contact tracing, remote home care for patients. And so what we had to do is just have a real conversation with the business unit and ask, where do you see this going? And can we just talk about the flow? What is the clinical flow? What is the flow of data? Where are the potential risks, so that we enable the opportunity to innovate and possibly do something that's groundbreaking in terms of supporting patients in the midst of a crisis. But at the same time, we are all on the same page with risk tolerance so that everyone knows where the potential risks are and how far we're going to mitigate those. But again, it's difficult to have those conversations on the fly and do them justice. But it's another one of those things, as the CISO, you need to jump out of your normal mold, put your business hat on, and help the organization understand, hey, I know we want to do, transition from acute to ambulatory, and we want to track post-acute patients with COVID with some cool, awesome new tool we've never used before and a wearable. But what does that all mean? And so that's some of the conversations we had, and you probably had as well. But again, it's back to being business-minded and business enabling to go through the same, back those same old-fashioned CISO questions.
Yeah, Dan, I couldn't agree more. At the end of the day, I think all of us were focused on doing what's right for our patients and families. And in doing so, we took the right approach and appreciate your insights on that. Pritesh, any particular thoughts on that particular question from your perspective as a service provider?
I think Dan covered it really well. It's all about, risk tolerance and business context. What risk is relevant for your own business, right? And then, prioritization, because there's always going to be a lot of risk for any business. So it's really around the prioritization of the risk and what investment is needed to address those risks, and making sure that everyone at the highest level is really informed about the risk. They really understand the risk and the investment we are making to address the risk.
Yeah, excellent. Pritesh and Dan, final thoughts on the state of third parties in healthcare and how best to navigate these relationships?
Yeah, I'll go first. My final thoughts are really forming a trusted relationship with a cloud partner, with pretty much all your mission critical cloud partners, maybe the single most important step for healthcare organization, especially when they are taking this journey to cloud. And trusted partnership is built upon open lines of communications, responsiveness, and comfort in discussing any issues that arise. Right. That's really the key here. And as IT organizations, like I mentioned, there are multiple programs, especially with these organizations going through the journey of cloud, moving the workloads to cloud. There are multiple security programs that they're currently managing, and that's adding a lot of overhead. So I think there's opportunities to unify and simplify their approach and unify the program across all their cloud platforms. And the last thing I'll say is, healthcare organizations should expect the service partners, especially the critical ones, to provide near real-time visibility into the security and compliance posture. That should be part of the service, because the annual, biannual assessments are no longer sufficient.
Dan, your final thoughts, please.
I think we need to catch up on the things we haven't been very good at. Those traditional vendors, that list I told you, the big list, we haven't consumed all of it yet, along with the new cloud-oriented services. And then when we look on the horizon, we've got new data sharing, interoperability rules, and other business functions to facilitate. And it's a huge challenge. And you've got to decide which services are most critical to our organization to facilitate our mission, and what are the most urgent threats that might disrupt that, cause us an event that might cause a financial loss, a patient safety issue, or other kinds of harm to the organization, and start ranking the most critical relationships, services, and then which controls should be in place to provide adequate protection. It's a long journey. There is no silver bullet for this one. It's just a lot of work, and organizations trying to figure out how do they scale this to being able to ask manageable questions relative to manageable risk.
Thank you very much for your insights. That's all we have time for. Thank you, Dan and Pritesh, for joining me. And Michael, back to you.